Welcome to the PMHNP Podcast, the definitive podcast for those passionate about mental health throughout every stage of life. Whether you're an aspiring professional, a seasoned expert, or someone simply keen to understand the intricate world of psychiatric care, you're in the right place. I'm Dr. John Rossi, a certified PMHNP, nurse educator, and lead content creator and instructor at Clarity Education Systems and www.PMHNPtesting.com. All right, welcome back. Excited to have this time with you today in our newest edition of the podcast. If you're like me, it's been a very busy year. You're already, if you're studying for your boards, well into the process of trying to memorize everything. If you've already passed your boards, and you're just trying to figure out how to be a nurse practitioner and how to get through all of the challenges that come with understanding your new role and trying to figure out how to make it like you know what you're doing. If you're like me, I was totally confused at the very beginning and I felt like I was faking it until I made it. But that's okay, as long as you stay within your scope of practice and you're doing everything that you can to follow clinical practice guidelines and adhering to the rules and regulations, you're going to be totally fine. But with that, one of the things that I wanted to talk about are laboratory studies. So whether you're preparing for boards or currently involved in clinical practice, labs are a huge part of what we do as nurse practitioners. I'll share a quick experience that I recently had working with a psychiatrist, and I was kind of shocked by it. And again, this is, I love psychiatrists, psychologists, anybody that works in our field, I am 100% for. But what I noticed was he never did any laboratory studies. And I know that he and I both worked with patients that were on lithium, that were taking antipsychotics, and we needed to monitor the metabolic status of the patient. I asked him, I was like, why aren't you monitoring laboratory studies? And he couldn't really give me a solid answer. It was mainly just, well, I'll let primary care do that. And that's a big problem, in my opinion. What we are working to accomplish is bridging that gap between mental health care and primary care. One, it is our responsibility to know laboratory studies, to understand how to interpret the results, to know when it goes beyond our scope and we need to communicate with our interdisciplinary team and potentially refer out to another specialty because of the laboratory results. And we need to be able to do that at our level. So that's why it's really, really important that we take the time to stay up to date on current evidence-based practices and evidence-based materials that arrives in monthly journals, and working with our counterparts within our clinics. If you don't have counterparts because you own your own business, making sure that you're part of a professional organization that you can speak with other members about these practices and what you can do to make sure that you're within appropriate guidelines and that you are up to date on laboratory studies. So that is what we are going to do today. So again, this should be for everyone, not just those that are preparing for their boards, but for anybody that is at every level of practice within their PMHNP role. Okay, so without further ado, we'll go ahead and jump right into this, and we're going to talk about laboratory studies. So baseline laboratory studies and ongoing assessments in psychiatry are really crucial. They're huge components of what a comprehensive patient care profile looks like, and this is for several reasons. They play a pivotal role in optimizing treatment strategies. They ensure patient safety and improve outcomes overall, which should be our number one goal. So these assessments are integral to identifying the right treatment approach and monitoring its effectiveness over time. So let's take a closer look at the importance of laboratory study, understanding, knowing when to order, the practice in general of labs. Okay, so first of all, it helps ensure an accurate diagnosis. So baseline lab studies can reveal underlying medical conditions that may present with psychiatric symptoms or influence mental health disorders. Conditions like thyroid dysfunctions or vitamin deficiencies, these can mimic or exacerbate mental health conditions and symptoms. And we're going to talk about that as we go into each one of these specific laboratory studies. They also help us rule out other causes. So they help rule out those physical conditions that could be contributing to or causing that psychiatric symptom. This is going to ensure that the psychiatric diagnosis is accurate and based on a comprehensive understanding of the patient's health. I cannot express that enough or, underline that enough or bold it enough. It is part of the full package picture. If you are not doing it, then you're doing your patient a disservice, and you could potentially diagnose them erroneously and potentially prescribe medications that are not appropriate for that patient because you did not do your labs correctly. All right, so medication safety, obviously a big part of this. Baseline lab assessments, they're going to ensure the safe administration of psychiatric medications. So especially for those with potential side effects affecting the liver, kidneys, the heart, or other critical organs within our systems. So knowing a patient's baseline organ function helps in choosing medications with the lowest risk profile. For medications requiring a therapeutic drug monitoring, so things like lithium and valproic acid, baseline levels and ongoing assessments are going to be critical in adjusting dosages to achieve that therapeutic level while minimizing the risk for toxicity. And that's really what we're worried about when we're looking at those therapeutic drug monitoring ranges. One, we want to make sure that therapeutically it's helpful, that it falls within the range that we understand to be beneficial for the patient. But really, we're looking at that risk for toxicity and causing more harm if we don't monitor it correctly. So early detection and looking for complications, that's going to be a big profile for monitoring for side effects. So regular monitoring helps detect the onset of medication side effects before they become severe. This is particularly important for drugs that can affect organ systems with delayed or subtle initial symptoms. Certain psychiatric medications require ongoing lab work to comply with safety guidelines, identifying and addressing potential adverse effects promptly so that you can go in and do the work that you need to do to take care of them before it progresses to an adverse reaction of grand proportion, and that could potentially lead to harm to the patient or even death. So ongoing assessments provide insights into how effectively a treatment is managing the psychiatric condition. This is going to allow for timely adjustments based on the objective data. Remember, objective data is the data that you collect, that you're gathering, not the subjective data that the patient is giving you. While that can be a part of the picture, this objective data based on the laboratory studies is vital. So these assessments enable a personalized approach to psychiatric care, considering the patient's unique biological makeup, how they metabolize medications, so we're talking about pharmacokinetics here, and their overall physical health. So why does this support overall health? Well, it really has to do with the holistic approach. Psychiatry increasingly recognizes an interconnection between mental and physical health. Regular lab assessments support a holistic treatment approach, addressing not just psychiatric symptoms, but the patient's overall well-being. My goal for this podcast is to get you on my side of laboratory studies. If you're not one that is conducting them, or if you're thinking, early on in your practice because you haven't even started practicing because you're still trying to get that certification done, that you will be on this bandwagon, that this will be something that you feel is important because of that holistic approach. Then we're also looking at preventative care. So baseline and ongoing labs, they play a role in preventative health care, identifying risk factors for physical diseases early and integrating preventative measures into that treatment plan. So we're looking at primary, secondary, on well into tertiary healthcare prevention because of laboratory studies. So in this podcast, we will not be able to go into all areas of labs, right? It's vast. And each one of your areas of practice, the clinics that you work in or the hospitals, are all going to use a different set of guidelines and different books for referencing and ranges. So you're going to have to take that into account. So know what your unit uses and what your organization that you have been certified and accredited for is participating in as far as resources and manuals and monitoring labs. But all in all, it's going to be fairly similar no matter where you go, because the evidence is very clear when it comes to these therapeutic ranges and also ranges when it goes beyond that results in toxicity levels. So I do want you to make sure that you are paying very close attention to your PMHNP review seminars. If you're a part of the PMHNP testing.com Clarity Education program for reviewing for your board, you got to make sure that you review those review seminars in order to get the pertinent and, very focused information that you need in order to pass your board, but then to utilize in clinical practice care as well. But we're going to take a closer look at the main points regarding those laboratory studies today in this podcast. So grasping those complexities of the human mind goes beyond mere observation, right? In practice, PMHNPs not only interview and watch their patients' behaviors closely during our assessments and in their sessions, but we also rely heavily on laboratory studies to reach precise diagnoses and identify suitable treatment plans. So while lab tests aren't necessary for diagnosing every psychiatric condition, they become crucial in specific instances to eliminate the possibility of underlying medical factors causing symptoms, or really to decide the most effective treatment strategy moving forward. So lab tests for psychiatric patients serve as an essential diagnostic tool. That's what it is. It's a tool that we use for mental health disorders. So these disorders are often difficult to manage because they lack physical symptoms. So your patient may not even present with symptoms at the time, but because of your laboratory results, you may know how to start treating them effectively to prevent that from going further to the point where they're having symptoms and adverse reactions. Making psychiatric laboratory tests a part of your clinical practice is going to help identify those conditions. So lab tests are crucial for accurately diagnosing. These tests delve into the patient's psychological, physiological, genetic, and environmental factors that can influence a range of disorders such as depression, anxiety, bipolar disorder, schizophrenia, and addiction. So understanding the biological underpinnings of these illnesses allows you as the healthcare professional to devise treatment plans targeting the disorder's roots, not just its manifestations. So laboratory science, it forms the cornerstone for advanced mental health care. And that's a bold statement, and I stand by it. So in psychiatric treatment, lab tests play a vital and key role in identifying the most effective medication and dosage. So you, the PMHNP, are going to monitor the patient on that psychotropic drug to ensure optimal treatment outcomes with minimal side effects. Advanced laboratory measurements help to adjust medication levels and make necessary changes. The big one here is going to be something like lithium. If my patient's lithium level is real low, it's not going to help. If it's too high, we're going to be toxic. But right in that sweet area of therapeutic alliance, that's where we're going to find the most benefit for the patient, and that's why managing medications is super helpful when doing the laboratory studies appropriately. All right, so tailoring these treatments based on their biochemical makeup, and that's going to help improve their overall results. Okay, so mental health issues often lead to both mental and physical symptoms, right? So the patient with depression, for instance, might face changes in appetite or sleep patterns alongside energy and motivation depletion. So medication side effects could also affect the physical health, causing changes in weight gain or heart health. That's why a comprehensive approach to that care, integrating lab studies and other evaluations, is so important, because we have to manage for things like electrolyte imbalances, the CMP, the CBC, where they put on a medication that can affect those laboratory studies by their primary care team that will then affect the lab results for your psychiatric treatment that will then affect how you administer and dose your medications. So lab studies provide quantifiable methods to assess the effectiveness of mental health treatments. They measure specific biological markers, and you gauge the severity of that mental health condition, allowing for the adjustments based on those markers and those identifying factors and those laboratory ranges that we reference. So genetic tests, we also need to remember that whenever we're talking about laboratory studies, we can do genetic testing. Not every clinic is going to want you to do this. It can be expensive, and it may not be appropriate in every situation. But genetic tests can help predict the risk of developing a psychiatric condition, such as schizophrenia. Through the identification of specific genes, that's what we're going to focus on when forecasting mental health risk factors. So early warning enables preventative measures before those symptoms can even arise. So this approach, far from being futuristic, it's here, it's now, it's becoming an integral part of medical diagnostics, particularly for individuals with a family history of mental health issues, which is why the family history is such a vital part of your assessment, and you have to get it. If you've got a family history with a patient that has two parents that have, maybe a mother that's been bipolar, a father that has a history of alcohol misuse and abuse and depression and anxiety, and a grandfather that also had bipolar disorder, then you better believe we're going to be looking at genetic factors and influences that have led to this patient either having something like bipolar disorder or schizophrenia, depression, alcoholism, whatever it may be. So early detection and intervention significantly mitigates the long-term impact of those disorders. All right, so establishing a baseline for medications that can impact organ function is a crucial step in ensuring patient safety and effective treatment management. So each medication or class of medications can affect different organ systems, and that's going to necessitate specific tests to monitor for these effects closely. So now let's dive into the specific baseline tests. We're going to go even a little further than just laboratory studies. We'll talk about ECGs and some other things as well. But what are these baseline tests that we use in order to help identify potential complications that resulted from medication administration or just treatment option and efficacy in general as we move forward with our treatment plan? So first, we're going to talk about ECGs. This is going to be a baseline QT interval. So this is very relevant for things like stimulants and some second-generation antipsychotics or SGAs. This can also be important for antidepressants, things like Celexa, so that ECG baseline QT interval. The reason why we do this is to monitor the heart's electrical activity and detect prolongation of QT intervals, and this can increase the risk of serious heart arrhythmias. So regular monitoring can prevent cardiac complications associated with psychiatric medications. Next is going to be electrolytes. We're looking at calcium, sodium, zinc, that's found in red blood cells, magnesium in red blood cells. Relevant for SSRIs and SNRIs. If this is the first podcast you're listening to and you're new to this area, selective serotonin reuptake inhibitor, an SSRI, or a selective norepinephrine reuptake inhibitor, serotonin norepinephrine reuptake inhibitor for SNRI. This is also important, the electrolyte for anticonvulsants, really important for anticonvulsants. So why do we do electrolytes? This is to ensure that balance is there, which can be affected by the medications that we just mentioned, and this can lead to potential cardiac and neurologic issues because of electrolyte imbalances. So maintaining electrolyte balance is going to help the nervous system and heart function and prevent complications. Next lab we're going to look at is complete blood count. Now, we're just kind of talking about these in general right now. Here in a few minutes, we're going to dive a little bit deeper. I'm going to repeat some things because I want you to hear it multiple times because it's that important. And if we hear it through repetition, I'm hoping that will help solidify these ideas in your mind. All right, so complete blood count, that's what CBC is, and this is done with differentials. All right, so relevant for anticonvulsants and some antipsychotics. The purpose of a CBC is to monitor overall health and detect conditions like anemia or leukopenia, which can be side effects for the medications that we're talking about. This is also going to help identify any underlying infections that the patient may have due to eosinophils, basophil. There's all kinds of laboratory results that are found within the CBC so that you can now communicate that to the primary care manager or your other interdisciplinary team members. Next up, we're looking at the human chorionic gonadotropin, or HCG lab. This is relevant for assessing pregnancy status. This is going to be used to determine pregnancy before starting any medication that could harm fetal development, like lithium. Crucial for avoiding medications that could pose that risk during pregnancy, and that's going to ensure both maternal and fetal health. Next is kidney function tests. So this is relevant for medications like lithium, SSRIs, and SNRIs. We do this to monitor kidney health and to ensure that these medications do not impair renal function. So proper kidney function is vital for the excretion of medications and metabolic waste, and this is going to help prevent toxicity. Then we look at lipids and blood glucose, definitely relevant for antipsychotics. So we use this to screen for and monitor metabolic changes, including dyslipidemia and glucose intolerance, which can be induced by antipsychotic medications. Early identification and management of metabolic side effects is going to help prevent more serious conditions like diabetes and cardiovascular disease. Next is liver function tests. This is going to help with anticonvulsants, some antidepressants, and substance use disorders, or SUD, treatment medications. So we do this to ensure the liver is processing medications properly and not experiencing damage. Remember, a lot of our metabolism, because of CYP450 drugs, is going to play a huge part due to liver function. And we need to make sure that it is functioning appropriately in order to not run into any pharmacodynamic and pharmacokinetic complications related to the liver. So liver health is essential for medication metabolism and preventing accumulation that could lead to toxicity within the body. A big one here, and lastly, we have thyroid function test or serum iodine test, so relevant for lithium treatment. Also to assess for underlying conditions with hyper or hypothyroidism. So this is monitoring thyroid health, as lithium can affect thyroid function, potentially leading to hypothyroidism or hyperthyroidism and causing conditions like depression and mania and anxiety and other complications based on the level of thyroid in the body. So maintaining thyroid function is crucial for metabolic and overall mental health, preventing mood fluctuations and cognitive issues. All right, so that's a general overview of some of the major laboratory studies that we as nurse practitioners will utilize in psychiatry. Now I want to dive a little bit deeper into each one of these and talk about them specifically. So first up, we're going to do a complete blood count, or CBC, and that's with differential. So we're going to say this is number one. All right, so the purpose, again, CBC is foundational in assessing and testing and watching out for health of blood cells. This is going to aid in the detection of conditions like anemia or infections, which could either mimic or worsen psychiatric symptoms. So red blood cell, these are general ranges. You're going to see them listed and referenced differently in all kinds of publications and books. So I'm just going to give you a general range here, but 4.7 to 6.1 million cells, MCL for men, 4.2 to 5.4 million cells, MCL for women. White blood cells, 4,500 to 11,000 cells per MCL. Platelets, 150,000 to 450,000 MCL. Those are going to be your normal ranges for CBC. So what does it mean if you have abnormal results? So low red blood cell count suggests anemia, potentially exacerbating symptoms of depression and fatigue. Elevated white cell counts could indicate an infection, affecting overall mental health wellness. So an important example of monitoring CBCs is when taking clozapine. Clozapine is a potent antipsychotic medication used primarily for treatment-resistant schizophrenia and for reducing the risk of recurrent suicidal behavior in schizophrenia or schizoaffective disorder. It is used, and its use is associated with a risk of agranulocytosis. This is a severe and potentially life-threatening decrease in the number of white blood cells, necessitating a comprehensive monitoring system to manage and mitigate the risks safely. So this system involves regular monitoring of absolute neutrophil count, or ANC, and mandatory enrollment in the Risk Evaluation and Mitigation Strategy, or the REMS program, which ensures that the benefits of clozapine treatment outweigh the total risks. All right, so ANC monitoring. Let's talk about this even a little closer. So ANC, that's that absolute neutrophil count. Weekly monitoring for the first 6 months upon initiating clozapine treatment. The ANC must be checked weekly. This is frequent monitoring because during that initial phase of treatment, this is when the risk of agranulocytosis is at its highest. Then we're going to move on to every week for the next 6 months. All right, so if after that first 6 months of treatment, all ANC measurements have been within the acceptable range, the frequency of monitoring can be reduced to every 2 weeks. Then finally, monthly monitoring thereafter. So after a year of continuous treatment with adequate ANC results, the monitoring frequency can be further reduced to once a month. So what do we do? What are some of our actions based on the ANC results? Again, we're talking within the realm of CBC laboratory studies now. So an ANC below 1,500 UL, this count is going to be considered the threshold for action. So if the patient's ANC drops below this level, it indicates a need for immediate clinical intervention, which may include discontinuing clozapine, depending on the severity of neutropenia and clinical judgment by you as the PMHNP. All right, and again, for REMS, registry reporting. REMS reporting for clozapine is going to require you and the pharmacy to be certified within the program, ensuring that you are prepared, and that they are prepared to monitor, manage, and report ANC levels effectively. So this program helps safeguard patients by ensuring timely and accurate ANC monitoring, facilitating prompt communication of lab results between labs, prescribers, and pharmacies, and then ensuring that clozapine is dispensed only when it is safe to do so based on the latest ANC results. So this is a stringent monitoring protocol, this REMS. The REMS registry enrollment, this is critical. This is a critical and a major component of clozapine treatment. It's designed to maximize therapeutic benefits while minimizing the risk of severe side effects. It really underscores the importance of collaborative approach among healthcare providers, the patient, and pharmacies when managing the treatment of a complex psychiatric condition. Why is this relevant? Conditions like anemia, systemic infections, these can all greatly affect energy levels and cognitive functioning, going to mimic and aggravate symptoms of depression and cognitive disorders overall, which is why CBC is such an important an important lab to monitor during treatment of your patient. Next up, we're going to talk about number 2 is going to be thyroid function. So these tests measure thyroid hormone levels. This is going to be essential for metabolic and mental health. Abnormal levels can lead to significant psychological symptoms. So let's talk about the normal ranges first. So for TSH, we're looking at 0.4 to 4.0, free T4, 0.9 to 1.7, free T3, 2 to 4.4. Now, again, these will change depending on the reference and the resource that you're looking at. But in general, that's our kind of normal reference range that we're going to be looking at. So an elevated TSH and a low T4, T3, you can see how this is an inverse relationship. Elevated TSH and low T4, T3 levels suggest hypothyroidism. This is going to be associated with depression and cognitive slowing. Conversely, low TSH and high T4, T3 may indicate hyperthyroidism, linked with anxiety and insomnia. What is the relevance for this? Thyroid dysfunctions are often linked to mood disorders, including depression and anxiety. This is going to necessitate careful monitoring and that management in order to treat the patient appropriately. Next up, we have liver function tests. Let's dive a little deeper. These tests monitor liver health, crucial for metabolism of psychiatric conditions and medications. They can identify liver damage and potentially impact medication efficacy and patient safety. All right, so normal ranges, ALT 7 to 56 units, AST 10 to 40, ALP 40 to 130. Abnormal results. Elevated liver enzymes may indicate liver damage or dysfunction. This is going to affect medication metabolism and necessitate dose adjustments and medication changes. Why is liver function test or LFT relevant? Liver health directly influences the metabolism of various psychiatric drugs. That's why monitoring is essential for patients on medications like antidepressants, antipsychotics, in order to avoid these adverse effects and ensure that therapeutic effectiveness has been reached. Kidney function test. I know we say liver is the most important thing that we need to look at when prescribing our psychotropic medications, but that's just not true. We have to pay attention to the liver and the kidneys. So kidney, we assess the kidney health through measures like creatinine and BUN levels. These are going to reveal conditions that can mimic psychiatric disorders and complicate treatment for drugs that are excreted from the kidneys. So normal ranges for kidney function: creatinine 0.6 to 1.2 mg/dL for men, 0.5 to 1.1 mg/dL for women. BUN normal ranges 6 to 20 mg/dL. Now, abnormal results. Elevated creatinine and BUN levels may indicate renal dysfunction, potentially affecting that mood and cognitive function. Kidney dysfunction can influence the body's ability to manage medications that are linked to those mood disorders. And so you're going to have to make changes, especially when we're talking about lithium clearance. If we cannot clear lithium from the kidneys, that's going to result in increased levels systemically. And so we have to make dose adjustments based on the fact that the kidneys are not clearing out the lithium appropriately. And we're gonna read that and judge that by the creatinine and BUN levels. Okay, some of the other ones that you may not think of right off the top of your head, but are very important, are going to be vitamin and mineral deficiency tests. See this a lot with patients, especially young kids, young females when they come in. One of the first things that I check. So several vitamin deficiencies can lead to mental health symptoms, affecting mood, can affect cognitive function, and overall brain health. So some of the key vitamins associated with mental health and symptoms are going to include, first, vitamin D. So a deficiency in vitamin D has been linked to depression, cognitive decline, and other psychiatric disorders. So vitamin D is important for brain health. And its deficiency can negatively affect those moods and cognitions. Next is vitamin B vitamins. So vitamin B1 or thiamine deficiency can lead to symptoms of confusion, irritability, and other mental changes. This is also known as Wernicke-Korsakoff syndrome in severe cases. Vitamin B1. Vitamin B3, niacin, a deficiency in this can cause pellagra, characterized by dementia, diarrhea, dermatitis. This can also lead to significant cognitive and psychiatric symptoms if it goes untreated. Vitamin B6. So this is essential for neurotransmitter synthesis. Deficiency may contribute to depression, anxiety, and decreased cognitive function. Vitamin B9, folate. So low levels of folate can lead to depressive symptoms and are associated with poor response to antidepressant therapy. Then we have vitamin B12. So deficiency can result in mood changes, depression, cognitive decline, and even psychosis. And this is often due to its role in myelin formation and neurotransmitter regulation. Okay, next we have vitamin C. So while less commonly associated with direct mental health symptoms, vitamin C deficiency can lead to fatigue and depression. Vitamin C is going to be crucial for general health and can overall and indirectly impact mood and cognitive function. Magnesium, though not a vitamin, magnesium deficiency is worth mentioning due to its importance in mental health. So low levels can cause symptoms of anxiety, depression, irritability, and confusion. So these vitamin deficiencies highlight the importance of a balanced diet and in some cases, supplementation and support mental health. Addressing deficiencies can have a significant positive impact on that mental health symptom and the overall well-being. So you're going to want to educate your patient on, myplate.gov and what type of what type of fruits and vegetables and lean meats, what are going to help increase and improve vitamins and minerals within their body. So minerals such as calcium, sodium, and potassium are crucial for nerve function and neurotransmission, and they can also affect mental health when their levels are not properly balanced. So calcium is essential for neurotransmitter release and nerve signal transmission. Calcium imbalances can manifest as cognitive issues, depression, and anxiety. Hypocalcemia, low calcium, can lead to neuropsychiatric symptoms, including mood disorders, irritability, and cognitive dysfunction. Sodium, so critical for maintaining cellular function and the electrical gradient across cell membranes. Sodium imbalances, both hyponatremia and hypernatremia, can lead to confusion, cognitive impairment, and even seizures. Severe hyponatremia can cause neurological symptoms, including altered mental status and irritability. Then we have potassium. This is a very, very important one. It's vital for nerve function and transmission of electrical impulses in the brain. Hypokalemia, low potassium, and hyperkalemia, high potassium, can affect mental health, leading to symptoms such as fatigue, confusion, and in some cases, psychosis. So again, balancing these vitamins and minerals is going to be key to maintaining mental health and the overall health of the patient. Deficiencies or imbalances may require dietary adjustments, supplementation, or medical treatment in order to restore optimum levels and alleviate associated mental health symptoms. Ranges for these labs are available in greater detail in the review seminars. So if you're a part of the PMHNP testing and Clarity Education Systems PMHNP review, then we're going to talk about the different levels of calcium, sodium, and potassium in depth, and we'll discuss what laboratory studies values you need to be watching out for. All right, so let's talk about a TDM, so therapeutic drug monitoring. moving beyond just some laboratory studies here, we want to talk about some of the monitoring options that we have available to you as a provider. All right, so therapeutic drug monitoring, or TDM, this is crucial, and it's a major component of clinical pharmacology that focuses on the measurement of specific drug concentrations in a patient's biological sample, so most commonly blood. So this practice is completed by a thorough clinical and pharmacological analysis, which is the ultimate goal of optimizing the appropriateness of the prescription regimen that you have the patient on. The fundamental premise behind TDM is the establishment of a clear correlation between levels of drug in the body and its therapeutic efficacy, and then the risk of potential toxic side effects. By tailoring drug dosages based on an individual patient profile and specific drug blood levels, TDM is going to aim to really enhance that therapeutic outcome while minimizing the risk of toxicity or adverse effects. This is a personalized approach, and it acknowledges the significant variability among individuals in how they absorb, distribute, metabolize, and excrete drugs. Such variability can be due to genetic factors, age, body weight, organ function, and interactions with other medications and overall health status of the patient. Now, although blood is the most commonly used sample for TDM or therapeutic drug monitoring, there are other biological materials that can also be utilized, and this depends on the drug being monitored and the specific clinical context. TDM may involve measuring endogenous compounds that are influenced by the drug's mechanism of action, offering further insight into the drug's effect on the patient. TDM is particularly valuable for managing medications with narrow therapeutic indices, with a small range between efficacy and toxicity. So this is crucial for drugs with complex pharmacokinetics or when treating conditions that require precise control to ensure therapeutic success. So examples are going to include management of anti-epileptic drugs, antipsychotics, antibiotics, immunosuppressants, and antiretrovirals, among many others. Implementing TDM in clinical practice, it's not only supporting optimal dosing strategies, but also plays a significant role in patient safety, healthcare cost reduction, and overall effectiveness of treatment regimens. So this is going to empower you as the clinician to make evidence-based adjustments to medication plans, ensuring that patients receive the most effective and safest dose of their medications. Again, this is by implementing TDM, or therapeutic drug monitoring. So TDM is especially relevant in neuropsychiatry, where it is applied to a broad spectrum of medications used to treat those psychiatric and neurobiological disorders. This includes both first and second generation antipsychotics, things like mood stabilizers, and antidepressants, each of which has a unique profile in terms of therapeutic window, metabolism, and potential for side effects. The careful monitoring of drug levels in patients being treated with these medications is going to help ensure the safety and effectiveness. So let's talk about antipsychotics first. So for medications like haloperidol, clozapine, risperidone, olanzapine, quetiapine, aripiprazole, these can all be managed by TDM and help in the delicate balance between efficacy and side effect. So clozapine, for example, is going to require that close monitoring due to its narrow therapeutic window and potential severe side effects, including agranulocytosis and myocarditis that we talked about earlier. Mood stabilizers, so this is your lithium, valproic acid, carbamazepine, and oxcarbamazepine. These are all mood stabilizers for which TDM is particularly valuable. Lithium, for example, and for instance, this is going to have that narrow therapeutic range that requires regular monitoring to prevent toxicity, which can affect the kidneys and the thyroid. Carbamazepine and valproic acid also have well-defined therapeutic ranges, and their levels can be influenced by various factors, including interactions with other medications, as well as genetic complications with specific alleles. Antidepressants, the effectiveness of and safety of antidepressants such as citalopram, sertraline, and venlafaxine, these can all be optimized through TDM, especially important when treating patients who are at risk for side effects, those that may be predisposed to a side effect profile based on family history, and those with treatment-resistant depression or individuals who have not responded to standard doses. We want to monitor it a little bit closer, and we're going to use TDM to do so. So TDM for these drugs involves measuring the concentration, then interpreting the levels by you, the provider, and then making clinical responses based on your experience and based on the evidence that supports changes by the concentration and the levels that you find in laboratory testing. So the application of TDM in managing neuropsychiatric medications is going to show that importance of tailored approaches to psychiatric treatment. All right, now let's go even a little deeper into that. I want to talk specifically about things like lithium, valproic acid. So these are all very game-on lab studies and drugs that you may find in your boards and just in general practice as well. So lithium and valproic acid are pivotal in the treatment of various conditions, particularly in the management of bipolar disorder. Both medications require that very specific and careful dosing and monitoring through the TDM to ensure efficacy while minimizing the side effects and risks of toxicity. So let's take a closer look now. So first up is lithium. Okay, so lithium, we have a therapeutic range. The therapeutic plasma concentration of lithium for acute treatment is generally considered between 0.8 and 1.2 mmol per liter. For maintenance therapy or prophylaxis of bipolar disorder, the range is typically between 0.6 and 0.8. Now, if we go below the therapeutic range, levels below this therapeutic range, they're just not going to be effective in managing the symptoms of bipolar disorder, and this is going to potentially lead to a relapse in manic or depressive symptoms. If we go above the therapeutic range, so concentrations above 1.2 start to increase the risk of toxicity. Mild symptoms of lithium toxicity include nausea, diarrhea, and weakness. Severe toxicity can lead to confusion, severe tremors, renal failure, and even coma. The risk of significant toxicity increases dramatically when we get above 1.5. All right, moving on to valproic acid, or VA, therapeutic range. Valproic acid, especially for things like bipolar disorder, is going to be a little different than the therapeutic range for other treatment options for this medication. So the therapeutic serum concentration for VA is typically cited at being between 50 and 125 for the treatment of bipolar disorder and seizures, which it does get a little different when you start to divide those two together. But definitely focus in on that 50 to 125. Now we have a below therapeutic range. Obviously, it's not going to provide and supply adequate control of the seizure disorder or stabilization of the mood in bipolar disorder. What can happen above the therapeutic range? So levels of exceeding the upper limit of that, about 125, this can lead to adverse reactions. So mild side effects include gastrointestinal disturbances, tremors, and sedation. More serious toxicity can cause hepatotoxicity, thrombocytopenia, pancreatitis, and encephalopathy. All right, toxic effects are more likely when serum levels exceed that 125, with the risk of severe adverse outcomes increasing as those concentrations increase. Monitoring the levels of lithium and valproic acid is vital and critical in order to monitor for that narrow therapeutic window and severe consequences of both underdosing and overdosing. So regular blood tests to check those levels of these medications are going to help ensure that the patient receive the optimal dose for their condition. Additionally, these levels can be influenced by factors such as other medications. We'll talk about what can influence lithium levels in the seminars, hydration status, dietary changes, and the patient's overall health in general. And that's going to necessitate that reassessment and reevaluation in order to decide whether or not you need to make adjustments to the dose of those medications. Okay, it's been about an hour or so since we started this discussion. A lot of good information. I'm hoping that this will spark your interest and will help you dive a little deeper into each one of these areas. There's definitely more to study here than just some of the general topics and terms that we've done today. But this is a good overview of what you as a PMHNP need to know and understand moving forward with laboratory studies. Before we end, though, I do want to talk about one more important thing, and that's toxicology screens. You as the PMHNP, you are right there when it comes to monitoring for this. Not only do we need to make sure that our patients aren't on substances that can hurt them, that can prevent them from having an effective treatment plan because of of drug-to-drug interactions. But we just need to be able to provide them with good knowledge and understanding. This is really important for the military population. This can be important for athletes, for those that work in federal jobs, or any job that monitors toxicology screens. Why do we need to know this? One, they could be taking an illegal substance which would pop positive based on the drug test that's being done. Or two, you could prescribe a medication that could potentially cause a false positive that would result in a lot of heartache for that patient and potential legal concerns or firing from a job based on the fact that good knowledge wasn't communicated to the patient and those monitoring. So we need to understand which drugs could potentially result in a false positive. So toxicology screen, what is the purpose? This is going to detect the presence of drugs, alcohol, or toxins which may cause or exacerbate mental health symptoms. Normal ranges, negative for illicit substances and toxins. That's your normal range. It's got to be negative. Abnormal results, going to be the presence of the substance indicating drug use or exposure to toxins, which can mimic or worsen the condition. And abnormal levels may vary depending on how quickly that drug has been metabolizing throughout your system, when the last time you took it, all of these factors. So the abnormal results can vary. We don't really need to worry about the level too much here. It's just if it pops positive, it's going to show there and you know that it's an abnormal result. What is the relevance here? Substance use disorders and exposure to toxins can lead to or complicate the mental health condition, may need to require changes in medication treatment plans, or may adversely affect a patient in their job status or circumstances where a positive toxicology screen would be seen as negative. All right, so generally that's what we understand about toxicology screen. Now let's go on to talk about what may show up as something else if you prescribe it to your patient. That way, if it does happen, you've got good clinical evidence to support the fact that, hey, calm down, it's okay. This is showing up this way because this drug can cause a false positive. First up, we have dextromethorphan. This may show up as PCP. Then we have diphenhydramine, which may show up as an opioid. Pseudoephedrine may show up as an amphetamine or a methamphetamine. Phentermine may show up as amphetamine. Quetiapine may show up as an opioid. A proton pump inhibitor may show up as THC. Promethazine may show up as an amphetamine or methamphetamine. NSAIDs may show up as barbiturates or THC. Quinolone antibiotics may show up as amphetamine, methamphetamine, and opioids. Venlafaxine and desvenlafaxine may show up as PCP. Sertraline could show up as benzodiazepines or LSD. Trazodone may show up as amphetamine and methamphetamine. And finally, for us today talking about these drugs, bupropion or Wellbutrin may show up as amphetamine or methamphetamine. There is a larger list, so make sure if you need to study these a little closer that you dive a little deeper, but these are some of the most general ones that you'll run into in your mental health practice. That, again, you want to be able to communicate well to your patient if they pop positive for one of these drugs and they're on sertraline or trazodone, and that way you can provide them quality education and provide evidence to help support their case should it be needed. All right, we are going to stop it there for today. This was a very in-depth look at some of the most important laboratory studies that you as a PMHNP need to know how to do. This is vital for you to understand for your ANCC or ANP certification exams if you're going to be testing sometime soon. And then just in general, for anybody that's practicing as a PMHNP, please make sure that you are utilizing your laboratory studies. It's vital, it's required, it's necessary. If something happens to the patient and they come back to look at your records and they see that you are not doing laboratory studies appropriately, that could reflect negatively upon you and may show that you are not doing your job as best you can based on the evidence, the guidelines, and the scope of practice that we all fall within. It was great talking with you today. I'm always excited to have these opportunities to speak through the PMHNP podcast. Looking forward to any future podcasts that we post. And if you have any questions, comments, or concerns, always make sure to reach out to us. We can be reached by phone, text, going onto the website, by email. We love being a part of this community. We love being PMHNPs. We are the future of mental health care. I have no doubt about that. And I just wish you the best of luck as you continue to prepare for your PMHNP certification and moving on into your clinical practice while you help every one of the individuals and families that fall within this special area of practice and care that is mental health. Have a great day, morning, night, whatever it is, wherever you are when you're listening to this. We will see you in the next podcast, and we will see all of you in the next seminar, either on demand or in person, for PMHNPtesting.com and Clarity Education Systems. One last plug here. Remember that if you're trying to decide if you want to use us or not for your studies, we do have continuing education available because we are accredited through the AANP. And we want to make sure that you get those CEs so that you can report them for your licensing to make sure that you're up to date on current evidence-based practices and approaches. Again, I'm Dr. John Rossi for PMHNPtesting.com and Clarity Education Systems. Bye-bye.